Hello guys, welcome back to my channel. My name is Dr. Pepple and I work here in the UK as a doctor. Basically, I do videos for international students and international medical graduates who are transitioning to study or to practice in the UK. If you're new to my channel, please hit on that subscribe button on the lower right hand corner and tap on the bell notification so you'll be the first to know when there's a new video. Well, today, I'm doing a very important, very special request video. I would say one of the most requested videos on my channel. It's about what's in my doctor's bag. So I'm going to be taking you through the journey of the contents of my doctor's bag. If you've been following my videos, you realize that I've just recently completed my residency training here in the UK, and my new job role entails a lot of home visits and out of hours shifts. And for this to go on very effectively, you need to have your personal doctor's bag with the basic medical equipment in it. So I have just purchased a new set of basic medical equipment that would enable me make some diagnosis and also try as much as possible to treat patients before sending them to the hospital if they need to go. First of all, I'm going to leave a link in the description box below which contains all the items in my doctor's bag in case you want to go through that, or if you're looking at purchasing one for yourself as well. Now let's get straight into it. So first is the bag itself. This is a Ted Baker document stripped bag. It's a brown colored one. There's a dark brown one and there's a black one. I actually like this one. I was using the big backpack when I was a registrar, but now I think I need something a bit more compact, and this is quite a good size. It's got 3 compartments, the central big one and 2 other smaller compartments. I got this from Harrods in London for less than 100 quid, and I think it's quite a nice one. It's quite comfortable, it's easy to carry about, and I like the feel. Next is my MacBook Air 13 inches. I've had this all through my residency training. It's quite a nice one. I use this for my personal stuff. Obviously, when you're working remotely or even when you're working at the base, like during out of hours, you've got the hospital computer to use for patient details and consultations. But if I want to do my personal stuff, like if I want to do my personal reading or if I want to download personal stuff, I like using my MacBook and it comes in quite handy. I think I need an upgrade now anyways. Maybe get the 2021 13 inches MacBook Pro. I like that one, it's quite fancy. But for now, this is what I use. So this normally goes in straight into the central compartment of the bag, and that's it. Next, I've got my new Littmann Classic 3 stethoscope. It's a high monitoring stethoscope with high acoustic sensitivity, and this is how it looks. I like the color, especially blue. It's my favorite color. We use this to listen to hard sounds and also to listen to the chest for any abnormal sounds. Next, I've got the electronic blood pressure machine. So this is a blood pressure machine. Actually, it helps us to take blood pressure of patients. It's quite an easy one to use, and we also advise patients to get this at home, especially if you've got blood pressure problems. Next is the thermometer. This is the electronic thermometer. It's the electronic forehead thermometer. Actually, it's on now. Basically, just on the forehead, it gives you reading. Look, mine is 36.8, so I'm active and alive. In this era of COVID, people are advised to have thermometers at home to check your vitals, so you know when to take some paracetamol, and if things don't get better, you can always call your doctor. Next is this tiny instrument called the pulse oximeter. It's actually the finger pulse oximeter. We use this to measure oxygen saturation level. You need oxygen to help your blood cells, especially your red blood cells, to function effectively. And when your oxygen level is low, it might indicate different things. So this is how it works. Put it on and just put it in. Just pop it into one of your fingers and it gives you reading. So you can see here my oxygen level is 100 and my pulse rate is 76. So basically, our normal oxygen level, anything above 94. If it falls below that, then there might be other factors that can contribute to it. Also, people are advised, especially people who've got respiratory problems like airway disease, asthma, COPD, are advised to have this at home because it will help you to monitor how your oxygen level is as well. Next is this instrument called the peak flow meter. This one came with some disposable mouthpiece, so we attach this to this. Basically, we also use this for people who have respiratory disease, who have airway disease, who've got asthma. It helps us to make an assessment. It helps us to monitor their progress. And how we use it is, this is a disposable one. It's one per use. I mean, the mouthpiece is one per use. So how we use this is you attach this and hold it in such a way that you're not occluding the readings, and sit in a very comfortable position. Take a deep breath in and blow in as much as you can. Next is this instrument. This is a diagnostic set. It's a new one. Some diagnostic sets actually come like both the otoscope and the ophthalmoscope. Ophthalmoscope is the one you use to look into the eye, especially to look into the back of the eye, and the otoscope is the one you use in looking into the ear. So I thought that was what I purchased. Unfortunately, it came as just the otoscope. So this is the otoscope. Now this also has earpieces and it's one per use as well. So this is the instrument itself, and we'll attach the earpiece to it. So we use this to look into the ear, especially children and people who've got hearing problem. Basically, we're looking for debris, we're looking for signs of ear infection. We're also looking if there's any wax, and we'll treat accordingly. Next is the tongue depressor. Tongue depressor also goes alongside with the ENT set. This is the wooden tongue depressor. It came as 100 pieces in one pack and is quite affordable. It's one per use. This is it. So we use this to look into the mouth, into the back of the mouth, into the throat, especially people who've got sore throat or who've got a swollen throat or who've got a problem with their mouth as well. We use this for mouth examination to check if the tonsils are inflamed, to check if you've got any lump or any discharge in your mouth as well, and if there are any signs of infection that will require some sort of painkillers, antibiotics, or even general measures of advice and reassurance. Also in my bag, I've got the urine dipsticks. Basically, this helps us to know if you've got urine infection, if you've got blood in your urine, or if you've got sugar in your urine, or if you're dehydrated. So especially when we visit older patients at home. This instrument is called the Tendon Hammer. I think the right name is reflex hammer. So we use this for neurological examination to test for nerves in the hands and in the legs, tendon and reflexes as well. I've got here the pen light. I like this one. It came as a pair. I didn't even realize that, and I like the fact that I've got options. So silver and a black one. This is how it works. Turn it on. So we use this basically for eye examination, to check for reflexes in the eye and also to check for some nerves in the eye. So that is the pen light. Also in my bag, I've got my hands-free earpiece. I use this basically for, there are some places where you go and they haven't got a hands-free telephone, or you're talking to patients on the phone and your hands are free to do your typing as quickly as you can, so you don't waste unnecessary time. So this was quite useful for me, especially when I was a registrar, when I was recording for my exams. Should I go to a place and they haven't got like proper hands-free telephone? So yeah, I use my one. Got a very good quality sound as well. This is a lateral flow test kit. This is not very necessary to be in the doctor's bag, but then again, I like being a bit extra. So because there are some patients you visit at home, especially elderly ones who haven't got the facilities to book for COVID test or for PCR or for the lateral flow test, especially they are having symptoms of COVID. So you want to do the early initial triage just to be sure everything is fine. Obviously you will still have your personal protective equipment. So you've got the cartridge itself, and you've got the strips as well, and also the face mask. I've got a couple of these ones always with me, and I've got some investigation blood forms. Again, these are not very necessary, but because sometimes you go for some visits and it becomes very imperative for you to do some blood work. Obviously, you'll be going with blood bottles from the surgery, so you can quickly take blood samples from patients, especially the elderly ones or the housebound ones, and fill up the forms, and you can send that to the hospital. So that's where the blood forms comes in, quite helpful. I've got my AirPod, my Apple AirPod here. Look guys, this is the 4th one I'm having in a year. If this goes missing, I'm not gonna have anyone at all. The Apple AirPod is quite useful, especially during break time and you want to listen to music or podcasts. I listen to a lot of music and you don't want to disturb people with sound. So yeah. And I also have my wallet. This is a Calvin Klein wallet. I don't do much with wallet anyways because most of my cards are Apple Pay smart card I use from my phone. But then again, my NHS card, which I use to access the computers at work, is always in this wallet. So I try as much as possible to be very careful with this wallet. Also, I've got my iPhone here. I think this is the Apple iPhone 12 Pro. I do lots of YouTube videos, Instagram Reels. When I want to do quick videos, especially during my break time, I use this. And I also have a tripod stand which I go to work with every day. I got some clean plain sheets and pen which I use for quick writing, and when I get back to the surgery I transfer this to the computer system. Lastly is my hand gel, just to keep the hands moist and fresh, you know, just some fine boy things. This is it. That's the content of my doctor's bag. Tell me what you feel. Is there anything extra? Are there things that are missing, basic things that are missing? Obviously there are a lot of things that are missing, but basic things that are missing. Now the question is, how do I fit in all these things into this bag? I'm gonna show you. It's quite easy. So thank you very much for watching this video, and if you haven't subscribed to my channel, please do that. Just hit on that subscribe button on the lower right hand corner, tap on the bell notification so you'll be the first to know when there's a new video. And if there's anything else you want us to talk about, anything you want to see on this channel, comment below, like this video and share it as well with your friends. Cheers, see you next time, bye.